Hey guys, Sabrina here, licensed massage therapist and certified cosmetic surgery specialist. And if you are someone who has been thinking about getting plastic surgery or already had plastic surgery and they're considering getting a different type of plastic surgery, these are the different types of plastic surgeries you could get. All right, let's start with number one and probably the most common plastic surgery that everyone gets, lipo. So you could get lipo anywhere in your body. Lipo 360, which is the stomach, the flanks, and the back. Or you could get lipo in your arms, lipo in your chin, lipo in your legs. But the number one thing that comes with lipo is that you have an excessive amount of inflammation. So when you get lipo done, they're sucking fat out of a certain area and then they're filling it with tumescent fluid. Once you get your massages done, after you get the tumescent fluid completely out of your body, it fills with lymphatic fluid, which is inflammation. What that is doing is it's help protecting your body from not going into shock, because you basically have a giant cavity inside of your body where the fat was and now fluid is in there. And these are also why, or this is also why it is so important to get massages after lipo, because what we do is we make sure that once that inflammation goes down, your skin can reattach to the muscle. And then all that inflammation will be out of your body. That being said, especially with lipo, that if the inflammation does not come out of your body properly or evenly, then you're gonna have pockets of fluid like this, wherever the lipo was, and it's going to create scar tissue. Now that scar tissue turns into fibrosis. And I will go over all fibrosis and all that stuff in another video. But when it comes to lipo, what they're doing is, plain and simple, they're sucking fat out of an area of the body and then allowing that space to try and reattach to the muscle, the skin. Now, there's also skin tightening lipo. Now, with skin tightening lipo, the skin reattaches to the muscle faster, and that's also why when you get skin tightening lipo, it's even more important to get massages, because the process of the skin reattaching to the muscle is even faster than if you were to just get regular lipo. So, that being said, very important to get massages after lipo, especially because you are higher at risk of getting fibrosis, which is scar tissue. Okay, so now number two, tummy tucks. So I actually have learned and realized going through a bunch of my before and afters of my patients that I actually have the most tummy tuck patients. And I honestly think tummy tucks is the most common procedure to get because, well, a lot of us moms, we end up having diastasis recti, and that's where our abdominal wall splits open after having children. And honestly, the only way, like, you could go get it sewn up from another surgeon, but the best way to do it, and a lot of my moms, the way that they do it, is that they go to a plastic surgeon and they get their abdominal wall sewn up, and then they have some of the loose skin that we get from having babies tightened down and then sewn up again. So now when it comes to tummy tucks, there's really three types of tummy tucks. There's a mini tuck, which is generally like from here to here. And then there is the normal tummy tuck from hip to hip. And then there's the extended tummy tuck, which goes all the way back here. And then you end up having an incision line like this. So that being said, when you're getting a tummy tuck done, you're generally having your abdominal muscles sewn up, which would be called an abdominoplasty, and then you're having some skin removal. Now, if you're getting the mini tummy tuck, sometimes they'll just sew up your abs that's from your belly button all the way down to your pubic area, because some of us, that's all that splits open when we have kids. And then they just cut off a little piece of skin, because not all of us have like an excessive amount of skin like myself. And then they'll just do a mini tuck. And then you get to keep your belly button, which brings me to the normal tummy tuck. So if you get a normal tummy tuck with an abdominoplasty, then they're generally sewing up your abdominal wall from here all the way down. And then they're going to pull the rest of your skin down and give you a brand new belly button. So say goodbye to your belly button if you're going to get the normal tummy tuck. Now, with an extended tummy tuck, which not a lot of people end up getting this unless you have a lot of loose skin. So if you end up having a lot of loose skin, especially right here in these areas, then you're gonna end up having the extended tummy tuck so that they can sculpt and make sure that you don't have any loose skin in any other areas if you were to have the normal tummy tuck. I have actually seen this on some patients that they get the normal tummy tuck from hip to hip, and then after that ends up happening, they have some loose skin or some hanging skin right here when they probably should have had an extended tummy tuck. So that's tummy tucks. Another thing to note is tummy tucks are actually the easiest procedure to heal from, especially if you are only getting a tummy tuck with no lipo. Now, lipo is in fact the hardest surgery to heal from, and it's the most painful. Well, painful. And with that, most surgeons like to do lipo on the sides here to sculpt the area when you are getting a tummy tuck. But even then, it's still super easy to heal from. In the beginning, you're gonna be hunched over because they're pulling all of the skin down and it's so tight. But when you're seeing your massage therapist or your professional that is helping you out post-surgery, like myself, then we lengthen the stomach and then eventually you're standing up straight. And eventually for a lot of my moms or a lot of weight loss patients as well, you end up feeling a million times better because now your abdominal wall is sewn up and now you can exercise more and you can feel better when you're doing your core workouts and all of these other things. So it's actually less painful. And I've noticed a lot of people heal twice as fast, especially if you start with me from the jump, from day one. Okay, so now another procedure that I like to say right after the tummy tucks is the body lifts. So a body lift, or a lot of people like to call it a 360 tummy tuck, is when they literally cut you all the way around. So now the body lift, it is in fact one of the hardest procedures to heal from, hands down. One, you are opening yourself up to more complications, and two, you are literally cut all the way around. So you have to be very, very careful. You have to be very careful with the way you walk. You have to be very careful the way you sit. You have to be very careful with the way that you are lifting your arms up and whatnot. So with tummy tucks and body lifts, in the beginning, you literally cannot lift your arms past here, 90 degrees. Especially because if you end up going all the way up, then you have a possibility of opening your incision, and even more with the body lift. Now, with my patients that see me after the body lifts, number one thing is making sure that that incision closes. Because a lot of my patients that end up getting body lifts, they end up going to generally TJ. And I've seen some of the best body lifts come from TJ. So now with body lifts, you have to just be very careful. If you have, and this is what I tell all my body lifts. If you listen to me from the beginning and you take my protocol, you will heal fast and you will heal good. And honestly, I've had so many body lifts. They've all healed amazing. They've all healed incredible. And if they don't, it's because they didn't listen to me. So remember that. Now the next thing, and generally when you get a body lift, it's because you're mainly a drastic weight loss patient. You've lost an excessive amount of weight. You have a lot of skin, and it's time to just let go of that skin. So sometimes with body lifts, some surgeons will recommend a torsoplasty. So now let's move on to torsoplasties. Torsoplasties is when you have a lot of skin right here, and if they did a body lift, it wouldn't matter because you'd still have hanging rolls here. So then they have to cut you right here so that they can lift the skin on both sides and you won't have any more skin in these areas. Now, a lot of my torsoplasty patients are also big-breasted patients who want a reduction. So I've had some patients that they get a breast reduction with the torsoplasty, and so then they end up having the breast lift from here all the way around. Another pretty difficult surgery to heal from. Once again, you can't lift your arms past here for a few weeks, and we got to get that incision closed. Once that incision's closed, then we can start doing other things. If you don't get lipo, it's actually quite an easy surgery to heal from. And of course, if those incisions close, then the rest is cake. The rest is cake. So now moving from torsoplasty to brachioplasty. For all my science people out there, brachialis, right? So then all of this right here is the brachioplasty, when they are cutting the skin on the arm and lifting it. And so then, especially if we have like drastic weight loss, then we're getting rid of all of the loose skin on the arm. And then they cut it, they tighten it. Super easy. Once again, if you don't get lipo done on it, then it's easy to heal from. However, we use our arms a lot, right? Yeah, we use our arms a lot. So depending on how your surgeon cuts you, because sometimes they'll go from here to here, then there's a possibility of getting it cut open, or opening, the incision opening right in the armpit area. So if you're getting a brachioplasty, which I've had a few, just be mindful. Red light has really helped my patients. Incisions heal twice as fast. So then once we get the incisions closed, then it's a cakewalk and it's super easy. And we're just getting rid of inflammation. And then after that, we can start breaking down scar tissue. So moving on from brachioplasty to Thighplasty. So a lot of my older people, so gravity, you know us, gravity. Everything starts drooping down, just like in our knees and just like in our thighs. Like, I know I'm probably going to need one of these when I'm older because I'm a big thighed woman. So once you get the Thighplasty, depending on how your surgeon goes into, sometimes if you have a lot of skin here and you need that good thigh lift, then they'll cut this way. And if they cut this way, then it's generally to like just lift the skin that way. I've also seen where they go in the groin and they cut into the groin, lifting the skin just so that we could get those knees to not look so droopy. And another thing, actually back to the brachioplasty, same thing. I have seen surgeons cut inside of the armpit, just lifting the skin right here gently so that that arm cannot be so hangy anymore and not have a lot of loose skin over here. I do prefer the cut right here, at least on patients, because it's more discreet. However, of course, if you come see me, I have so many patients. I've actually minimized the scarring and made the scar look absolutely invisible with my technique using hands and other things. So we've already talked about lipo everywhere. We've already talked about tummy tucks, all three types of tummy tucks. We've talked about body lifts, torsoplasties, brachioplasties, and the thighplasty. So now let's move on to boobies. So when it comes to boobs, there's so many different types of avenues that you can take, and I'm a certified breast massage therapist, so I've worked with all different types of boobs. So now let's just start with plain implants. So a lot of surgeons, they will just cut underneath the breasts, stick in an implant in there, and give you the nice cleavage that you want. Whether you want to be an exaggerated cleavage or you just want to look natural. Totally up to you and your surgeon, but those are generally, they'll go in through here. Unless they go through your armpit. I've had a few girls that they go through the armpit and then they stick the implant in through the armpit, and it actually, I've noticed, has made the breast go up like this, and they have more cleavage. I do like that look. However, and from what I've learned, you have to think about, you can't really lift your arms up too high. I mean, with any breast surgery, you're only localized to here for like 2 weeks, 2 to 3 weeks, depending on how fast you heal and how fast we get the inflammation down. But scar tissue changes, hair follicle growth. So if you are going through your armpit, there could be a chance of you getting ingrown hairs, especially because the hair follicle growth can either go away completely because scar tissue changes that, or when you get the ingrown hairs in there, I've seen it, it's painful, and that's a whole other issue in itself. Consult your surgeon if that does happen. But I have seen the look, and I do love the way that they look. Now, if you are a big breast woman and you need to get, and you want to get a reduction. So when it comes to reducing breasts, and you have a lot of skin and you have a lot of breast tissue, you're going to need a lift and a reduction. So with that, they'll generally do the T-shaped or anchor-shaped incisions underneath the nipples and around the breast to help lift the breast, and then they'll cut the excess skin to the breast size that you want and that you consult with your surgeon. Now, if you're getting a breast reduction, I don't really see any other way not to get the anchored incision because you're getting skin removal. Now, same thing with a breast lift. If you're getting a breast lift done, they have to lift the girls, so they have to do the anchor shaped and then all of that jazz. And so now, going over the different types of implants, the different types of ways that surgeons put implants in your breasts, and the different types of breast lifts and reduction. And then implant size. Ooh, okay, actually, one thing I love talking about, implant size. So a lot of girls think, oh, I don't want to be really noticed and all of that stuff, and they want to go for like 200 cc's or even 300 cc's. I have seen some smaller frame girls have 500 cc's and it actually looks really good on them, and it doesn't look like huge boobs. So make sure, I would look at the implants. I would even talk to other girls who have different implant sizes so that you could get a good idea of your body frame with the implant size that you want, and then make a judgment from there based on the cc's that you want for your body frame. Not, sometimes 300 might be small, even 250 like might be a smaller size for your body frame. So I definitely recommend looking at the implant size before you make a big judgment on what kind of implant you want. For example, I had one patient, she wanted a breast lift, no implants, and she ended up becoming super flat chested. And I was like, girl, just go get the 300 cc's. It'll be a nice little perk, it would fit you so well. She listened to my advice. She looks incredible. That being said, implant size, cc's, just look at other girls, try to get information. That'll best help you on what implants you want. Now, moving on from implants to face. So when it comes to face surgery, I love talking about it because I definitely know what my plan is with my face. Probably when I'm 35 or 40, I'll get my blephs. And then eventually when I'm like 55, I'll do my deep plane facelift. So now, what are these things? So a blepharoplasty is when they actually remove the skin on either the lower eyelid or the upper eyelid or both, and they tighten up the eyes. And let me tell you, it really does make you look younger, like significantly younger, especially if you already have some drooping on the eyelid or some drooping down here. So that is what a blepharoplasty is. Then we got the neck lift. So in my family, we got big cheeks. So a lot of my family, they end up drooping down. And so that's why for myself, when I'm like 45 and I start noticing the droop, I'm gonna get me a neck lift. And so what a neck lift is generally some surgeons, they'll cut through here along the ear, and then they'll just lift the neck. Now, some surgeons will do lipo, but a lot of them, they're just lifting that skin. They'll just lift the skin right here. And on one patient in particular, and a doctor I really love out here in Vegas, she literally looked 15 years younger. I was so amazed. I was like, oh my God, I gotta go to that surgeon when it's my time. And so then we got the facelifts. So now facelifts and brow lifts, a lot of these surgeons, they will go in through the hairline right here. And when they go in through the hairline, they will lift the face and lift the brows, and so then you can't really see the scars. So now With the facelift, it's just so much lifting very gently. Of course, if anyone's going to touch your face, I highly, highly recommend you do your research and you see that person's patients, like past patients, so that you can get a good idea of what your after results are going to look like. Now moving on to rhinoplasty, which is nose job. So I've seen some good nose jobs, I've seen some poor nose jobs, but the main thing is just do your research, know which surgeon that you like, and get when you're gonna get your nose done with your rhinoplasty. Another one is the buccal fat removal, is when they remove the fat from your cheeks, and generally they'll go in through here and take out the fat, and it'll scrunch you up. Some girls like it, some girls don't, some guys like it, some guys don't. And at the end of the day, all of this is preference, right? Okay, so now let's talk about the deep plane facelift. So the deep plane facelift is a facelift that focuses on the deeper tissues within our face and lifting them from the inside and actually giving you a more long-lasting and rejuvenating look. One person I love to give an example to is Martha Stewart. She is like in her 80s and looks absolutely insanely incredible. Same thing with Lindsay Lohan. These women, they went and had a deep plane facelift with some incredible surgeons, and it just literally cut off their age. Like, they look so good. I know I want to get that when it's my time, but that is all the procedures that I could think of. If there is any that I'm forgetting, leave a comment. And then, of course, I'd love to go and talk more about that. But anyways, thanks for watching. Hope you enjoyed the content. And like, share, subscribe, hit the push notifications. And as always, have a beautiful day.